Do, 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 do.
Good evening. I'm Dylan Frank, and this is RDC News at 6. Tonight we have a special report on cystic fibrosis. Joining us tonight will be a brave young woman who at the young age of 7 was diagnosed with cystic fibrosis. Riley Thornton, now at 19 as a nursing student, is going to share her story with us. As well, all the way from San Diego, we have Dr. Emerson Cooper, a specialist in cystic fibrosis, to give us a more in-depth look at what Riley's been going through. Riley, do you mind telling us what it's been like living with cystic fibrosis?
Well, first off, it's important to note that cystic fibrosis is an autosomal recessive genetic disorder. As this diagram shows, if both parents are carriers of the recessive gene, there's a 25% chance that they'll have a child that will be diagnosed with cystic fibrosis.
Dr. Cooper, would you be able to explain to us in more detail how exactly cystic fibrosis is affecting the body?
Sure. When I think about cystic fibrosis, I relate everything back to three key concepts: proteins, the cell membrane, and maintaining homeostasis in the extracellular fluid.
Okay, so where exactly is the mutation?
Well, there are over 1,000 various mutations on the genome that code for cystic fibrosis. The most common one is found on chromosome 7. This mutation accounts for approximately 70% of patients who are diagnosed with cystic fibrosis and is found on the chloride transport protein called the cystic fibrosis transmembrane regulator.
My doctor called it the CFTR for short, and he said it's found in the cell membrane of epithelial tissues.
Yes, to relate back to the concept of proteins, the CFTR is produced in the rough endoplasmic reticulum inside the cell. In the rough endoplasmic reticulum, protein synthesis is impaired due to the loss of the amino acid phenylalanine, which is caused by the autosomal recessive trait.
What does the loss of phenylalanine affect?
This affects the formation of the CFTR protein, and the impaired protein isn't sent to the Golgi apparatus for finalization of protein synthesis. In the rough endoplasmic reticulum, the amino acids are folded to make the proteins, and only 2% of the amino acids coded for cystic fibrosis are sent to the cell membrane. The other 98% are marked for degradation.
So, how are the proteins impaired then?
Well, the loss of phenylalanine inhibits the ability to bind ATP, thus disabling the opening and closing of the protein channel and resulting in defective ion transport, most notably the chloride ions.
In homeostasis, chloride ions move in and out of the cell through an unaffected CFTR protein. Normally, chloride concentration is higher outside the cell in homeostasis. Due to the defect in the protein, there is an abnormally high concentration of chloride trapped inside the cell, and this affects normal homeostasis. Sodium concentration in the cell is also affected, and due to the high concentration in the ICF of sodium and chloride ions, water moves by osmosis from the ECF to the ICF.
So, what do the high concentrations of chloride and sodium in the intracellular fluid mean for you, Riley? How is this affecting your body?
This results in very thick mucus, and this thick mucus makes it very difficult to breathe when it's built up in my lungs. This is because it traps bacteria and becomes infected, causing inflammation and the release of chemicals which can lead to damage of the lung tissue. Similarly, the mucus goes to block the pancreatic duct and the reproductive ducts.
Dr. Cooper, earlier you had mentioned that it's also affecting the sweat glands. Could you go a little bit into that for us?
People with cystic fibrosis have elevated salt levels in their sweat. In homeostasis, ions move from sweat glands to the ICF, but the CFTR protein is unable to resorb ions back in the sweat ducts, so chloride stays trapped inside the duct and is sent to the skin.
In summary, chloride is trapped in the cell, and there is a theory that the sodium ion movement is also halted. Because of the higher concentrations of the sodium and chloride within the cell, water flows via osmosis into the cell, resulting in thick mucus. This mucus builds up in the respiratory system, causing infections and difficulty breathing, as well as problems with reproduction and digestion. What a fascinating disease. Unfortunately, we've reached our time for today. I'd like to thank Dr. Cooper and Miss Thornton for joining us tonight to help us all understand cystic fibrosis a little better. I'm Dylan Frank. Stay classy, Red Deer.